Your cat eats dry kibble twice a day. You see a full bowl, hear the crunching, and think, teeth are fine. Then one morning, there's a drop of blood in the water dish. The cat is only eating on one side of its mouth. Dry kibble doesn't clean your cat's teeth. This is one of the most persistent myths in cat care. And it's the one bringing your cat closer to a dental surgery table every single day. But blood in the water dish is just the final stage of a process that may have been running for years. Let's start with why it begins at all. Dental disease in cats is a group of conditions. Plaque, tartar, gum inflammation, periodontitis, tooth resorption. They all start the same way. Bacteria form a film on the tooth surface. Without cleaning, that film mineralizes within days and turns into hard tartar. Tartar pushes the gums away from the tooth. Bacteria get into the gap. Inflammation begins, followed by breakdown of the bone around the tooth. Cat's enamel is much thinner than humans, so a process that takes years in a person can develop in a cat within months. According to veterinary clinics, most adult cats over 3 years old show signs of periodontitis at some stage. Most owners don't notice because cats hide pain. This isn't a problem that appears suddenly. Plaque forms daily with every meal. Left unaddressed, it turns into tartar within days. So the question isn't whether the problem will appear,
But how early you'll catch it. A cat won't tell you it hurts. It adapts. So early signs are always indirect. Bad breath is the first and most common sign.
don't confuse it with normal food smell right after eating. This is a persistent sour odor that lingers for hours. Next, look at the gums themselves. Redness or swelling along the gum line. Excess drooling, sometimes tinged with blood. These changes in the mouth also show up in eating behavior. The cat eats more slowly than usual or chews only on one side. Drops food out of its mouth, trembles its jaw, or clicks its teeth for no visible reason. Avoids hard food it used to eat eagerly. If the process continues longer, general signs appear too. Loss of appetite with no obvious cause. Weight loss over a few weeks. The cat rubbing its face against furniture more often, trying to relieve discomfort in its mouth. Each of these signs on its own might seem minor. Together, they're a signal for a clinic checkup, not for waiting it out. Age is the main risk factor. Risk of dental problems rises nearly linearly after age 3. Breed matters too. Some breeds genetically have thinner enamel or more crowded teeth, which makes natural self-cleaning harder. Some risk factors are entirely within the owner's control. The main one is lack of home care. A cat that's never had its teeth brushed accumulates tartar faster than any other cat the same age. There are also factors an owner doesn't directly control. Viral infections, calicivirus, feline immunodeficiency virus, feline leukemia virus, raise the risk of severe oral inflammation. Chronic vomiting also raises risk. Stomach acid repeatedly contacts tooth enamel and weakens it. Multi-cat households deserve a separate note. Several cats crowded into one home raises the risk of oral viral infections spreading, so it's worth watching each animal's gums individually and more closely there. Before getting into causes and methods, 3 things you need to know up front.
Because a mistake here costs the cat its health. Never brush a cat's teeth with human toothpaste. It contains fluoride and foaming agents not meant for feline digestion.
Some contain xylitol. Studies show cats tolerate xylitol far better than dogs, and fatal cases in cats aren't documented the way they are in dogs. But the data is limited, and fluoride and detergents are harmful regardless of the xylitol. Use only toothpaste made specifically for cats. Never give a cat hard bones, antlers, or hard plastic chew toys. A cat's thin enamel breaks against hard surfaces. A broken tooth isn't a cosmetic issue. An exposed nerve means constant pain with every bite. If you see blood in the water bowl, facial swelling, or the cat refuses food entirely for more than a day, that calls for an urgent vet visit, not home remedies. Some feline dental conditions are extremely painful and can't be diagnosed by eye. And a separate note on dosing. Never carry over. supplement or medication proportions from dogs to cats. Cat metabolism is different. The liver processes some substances more slowly, and a dose safe for a dog of the same weight can be excessive for a cat. Every dosage figure in this piece is verified specifically for cats, not borrowed from dog instructions. Now, the reasons cats' teeth break down and what to do about each one. For decades, owners were told, dry food cleans teeth, wet food doesn't. That's false. A kibble piece shatters the instant it contacts the tooth. The abrasive action it was supposed to provide simply doesn't have time to happen.
On top of that, cats are predators that often swallow kibble almost whole without chewing. Clinical observations confirm it. Cats fed only regular dry food accumulate plaque and tartar at the same rate as cats on wet food.
The food type alone isn't prevention. If you want food that actually affects teeth, choose one with Veterinary Oral Health Council (VOHC) approval. For example, lines like Hill's Prescription Diet T/D or Royal Canin Dental. These foods have a specially structured kibble that doesn't shatter instantly, instead providing mechanical cleaning of the tooth before it breaks apart. Regular adult cat food has no such effect, regardless of what the packaging says. Food is only one tool. The second risk factor hides in the toy box. Bones, deer antlers, and hard plastic toys are sold as dental aids, though in practice, they're one of the leading causes of broken teeth in cats. The reason is simple. Thin feline enamel can't handle loads designed for larger animals' jaws. The fracture often goes unnoticed by the owner, and the cat simply goes on living with an exposed nerve and chronic pain. So the best solution is to remove any hard chew items from the house entirely and replace them with toys and treats, bearing the VOHC seal of approval. That seal means the product has been tested for safety and real dental effectiveness, not just a marketing claim.
The third factor is entirely in the owner's hands, and also the most often skipped. Without mechanical removal, plaque mineralizes into tartar within days.
After that, tartar can only be removed by professional cleaning under anesthesia at the vet. Home remedies don't work on tartar that's already formed, so the only thing that actually works is daily toothbrushing with a cat toothbrush or finger brush and toothpaste made specifically for cats. Start gradually. Let the cat lick the paste off a finger for a few days in a row. Then move to brief touches to the teeth, and only then to full brushing. The goal is 5 to 10 seconds of brush contact with the outer tooth surface daily, though even a few brushings a week beats no care at all and noticeably slows tartar buildup. If a cat categorically won't accept the brush, don't force the process. The stress of the struggle damages trust and rarely succeeds. It's better to stretch training out over several weeks than to create lasting resistance to any handling of the face. These last two causes differ from the previous ones, in that an owner can't prevent them entirely on their own. Tooth resorption is a condition where the tooth's own tissue gradually breaks down from within. The exact cause is unknown and still being studied, but researchers link the risk to age, breed, and the presence of tartar and gingivitis. Estimates vary, but somewhere between 30 and 60% of cats show signs of resorption at some point in life. In early stages, the only visible sign is redness of the gum around a single tooth, while the process itself only shows up on an X-ray. Chronic gingivostomatitis is severe oral inflammation associated with calicivirus and an inadequate immune response. It's rarer, affecting under 5% of cats, but extremely painful. The inflammation spreads beyond the gums, to the mucous membrane, all the way to the back of the mouth. Neither condition can be diagnosed at home or treated with supplements or brushing. If you notice redness around one specific tooth, persistent gum inflammation that doesn't clear up after brushing, or refusal to eat despite visible hunger, you need a vet exam with a jaw X-ray. If gingivostomatitis is suspected, it's also worth testing the cat for calicivirus, feline immunodeficiency virus, and feline leukemia virus, since treatment depends on the underlying cause. In severe gingivostomatitis cases, partial or full tooth extraction remains the standard treatment. It sounds drastic, but clinical experience shows most cats eat and behave far more comfortably after the procedure than before it, since the source of chronic pain and inflammation is gone. No supplement replaces brushing and a vet checkup. but two categories have real, tested evidence behind them. And this is the main alternative to hard bones and empty promises from dry food. Brown seaweed powder, Ascophyllum nodosum, added to food at roughly 1 teaspoon a day, depending on the cat's weight. Products like Proden Plaque. This isn't a marketing add-on. The product carries VOHC approval, and in clinical trials, daily use over a month showed roughly a 32% reduction in plaque
and about a 35% reduction in tartar. The powder changes the chemical makeup of saliva, making it harder for bacteria to attach to the tooth surface.
Important caution. This product is contraindicated for cats with hypothyroidism due to its iodine content, so check thyroid status with a vet before starting it. A water additive based on sodium hexametaphosphate, products like Healthy Mouth, also carries VOHC approval. It's added directly to drinking water. Hexametaphosphate binds calcium in saliva, leaving less calcium available to form tartar. It's a convenient alternative for cats that flatly refuse any food additives. Coconut oil is popular in cat care advice, but the evidence here is different. There's no direct clinical proof of coconut oil's effectiveness for cat dental health. Only lab data on the antibacterial properties of lauric acid outside the animal's body. So it's mild support at best, not a substitute for diagnosis or brushing. Coconut oil can be used as a flavor element while training a cat to accept brushing, not as a standalone preventive measure. Dental treats and chew sticks are also worth mentioning, but only if they carry the VOHC seal. Without it, the manufacturer may have tested the product for taste and texture, but not for actual effect on plaque or tartar. The VOHC seal is the only reliable marker among the dozens of products on pet store shelves and Amazon promising cleaner teeth, with no clinical data behind them. Your cat's teeth don't break down from one instance of bad care. It's an accumulation. The dry food myth. Hard chew items, lack of daily brushing, and in some cases, processes the owner has no control over at all, like resorption or gingival stomatitis. The controllable part of this list is the largest part. The right food, safe chew items, daily brushing, and 1 teaspoon of seaweed powder in food daily. That's a real, research-backed combination that reduces risk, not just a marketing promise on a package. None of these steps replaces regular vet checkups. The goal isn't to eliminate dental interventions entirely, but to make sure the cat arrives at each checkup with as little accumulated damage as possible.